My name's David Coles. I'm an occupational and hand therapist and I work at Southport and Palm Beach in my private practice. Primarily I work in trauma, dealing with the rehabilitation of hand and upper limb injuries. A lot of the day-to-day work is involving wound care and oedema management, splinting and obviously with the work cover patients, the return to work facilitation. We always like to get best physical outcomes, but I think with physical outcomes comes the emotional and psychological well-being for the clients as well. It is a focus for us and a very important outcome to get the patient back to work early and safe, and having a predictable return to work is important. Good communication with all the stakeholders. I think it's important that we keep up to date with all of our continuing professional development as well. A lot of our workers have, in my line of work, have significant trauma, so they all have a significant time off work, and there's often a complicated return to work program that needs to come into place. My written application had a big crush injury with multiple fractures, 12 fractures and tendon and nerve repairs. We always focused on the work. We had psychologists involved, key stakeholders with the doctors. We had meetings about this gentleman, and he did return to work on full hours, not full duties, with his trauma, and I think that's one example of an excellent outcome. He didn't get back to work until 12 months down the track, but he's still currently there. He's working 60 hours a week and he's happy. He's had another baby and himself, and he's working through his current injury. I've had the freedom of doing some of the worksite visits myself. I think that this, for my patients, has had excellent outcomes in terms of, I know the patient physically, emotionally, motivationally, to help guide them through the return to work process. Go back before the patient comes in, I think that we try to keep very much up to date with evidence-based practice with our education. So I've got a heavy focus on of training and keeping up to date with my current memberships with the Australian Hand Therapy and the Occupational Therapy Associations. You get the patient in thinking about them holistically. They will improve in all facets. You focus on, say, their leisure of return to fishing or surfing, that will be incorporated into returning to work as well. And I think if the more everyone's aware of each other's needs and goals, then I think that everyone's more at ease with having a sustainable, good return to work outcome. What I find rewarding about my role is on many levels. As a clinician, I find, intellectually, the work in hand therapy and hand and upper limb therapy is very challenging. I like the social aspect of my work. We have a high turnover of patients, and we get to find and hear a lot of stories of people's stories and lives that is rewarding to hear, and also to change and modify and have good outcomes in terms of returning to work, returning to leisure activities, keeping people's pain down. On many levels, it's extremely rewarding.